We're joined by Dr. Roger Olson from St. Luke's Children's Hospital. Doctor, thanks so much for joining us to talk about how kids are coping with coronavirus. And we're going to talk about a children's book that recently came out that I think we'd like to hook up the parents with. Easy to do. We'll get to that in just a second. But let's talk about this. These are troubling times for adults. Can't imagine what some of the kids are going through. So what are some words of advice you can give to parents who are in the house with a number of kids, trying to talk to them about what's happening not only in our community, but around the world?
Absolutely. This is a very challenging time, and parents are the coaches and the guides for kids as kids navigate this difficult situation. And so it's really important to be able to sit down and have a conversation with your children and talk to them about what's going on in our communities, in our world, and what we're doing to prepare in the broader environment and also in our homes.
Mm-hmm. And you probably, I'm guessing, depending on the age of the child, you want to be as truthful with them as possible, but on the other hand, you don't want to be doom and gloom, correct?
Absolutely. You want to let them know that we're being prepared as we can, but we want to be guided by our values, like being caring towards ourselves and towards our neighbors and our families, but also we don't want to be guided by fear.
Mm-hmm. How is St. Luke's Children's Hospital coping over the last few weeks?
We have a vast array of healthcare workers and administration that are doing everything we can to provide support for our community, because that's one of our values.
Mm-hmm.
And in the Children's Mental Health Clinic, we're doing a lot of video therapy sessions since we can't see kids face to face.
Are you seeing any kind of a spike in questions or phone calls or emails, or are we still in the early stages of this here in Boise?
Well, I think it's continuing to grow, especially as parents are feeling the stress of having a house full of children and having job insecurity and slowing down in a lot of different areas. So parents are looking for ways to not only have their own self-care, but also help their kids through this.
Well, and I think that's so important to go down that avenue, is that the kids obviously look up to their parents. They mimic their parents. They'll even act like their parents. So sometimes when we get all caught up with what's happening, whether it's with our job or our parents or our grandparents, they'll feed off that vibe that you're giving off. Is that true?
Absolutely. And so what I often say to parents is that parents with regulated emotions are more likely to have kids with regulated emotions. So as we learn to deal with this by doing things like exercise, mindfulness skills, breathing exercises, talking to our friends through texting or email or social media, those are going to be important things for parents to regulate our stress, so that then the kids will feel less effect of that stress.
I know a lot of board games have been dusted off, even our house, and whether it's a game of Monopoly, if they can handle that. Though I know that can get kind of stressful playing Monopoly, but even working on a family puzzle together.
Absolutely. And as we're doing those things, we're minimizing exposure to stressful media, whether it's internet or movies or TV, especially with young kids. We have to limit their exposure to the media during this difficult time, so that they're not overwhelmed with what's going on in the world.
Right. And they miss their classmates, their friends, and everything else. But the common denominator too, doctors, is to get outside, keep the safe distance from everybody, but to get in the backyard and play a game of catch, or going out in the driveway and shooting some hoops, right?
Absolutely. And that brings us to this idea of a structured routine. And it's going to be a new routine during this time, because everybody's schedule is changed. So trying to have a way to establish a new routine for bedtimes and for doing schoolwork, because we don't want to just have no structure, because that will feel unsafe for kids.
One thing I want to talk about, I thought this was interesting. There's a children's book out. It's kind of interesting how quickly we can get these things out to the general public to help them along. The Story of the Oyster and the Butterfly, The Coronavirus and Me is the title of the book, and it's a book for children to better understand what is happening in their world right now. And I went through it. It's a even for me, it's a pretty quick read, which I appreciate that. But it's interesting. It tells the kids that they can use their own powers to create their own pearls.
Yes. Yeah, Anna Gomez is kind of a trauma therapist, and she put this out, and parents can have access to this on YouTube. So just type in the name of that book, The Story of the Oyster and the Butterfly, and you can see it on YouTube and have it be read to your kids. But yes, what she's getting at is helping kids realize that they have the ability to cope with stress and to face up to difficult emotions and stressors, but not be overwhelmed by them, by using other powers of emotion regulation, expressing their feelings, and the powers of soothing their emotions.
Mm-hmm. Well, it's an interesting time for so many reasons, but I guess one of the positives, the silver linings out of this is families are spending more time together.
Absolutely. And that, reminds me of this idea that even when there's strong emotions, parents can see that as an opportunity of greater connection with their children as we use empathy and understanding. And that will kind of bring new life to those relationships as we try to understand each other with compassion and love.
If anybody wants to reach out to you or your colleagues over at St. Luke's, is there a way for them to do that?
Absolutely. Just call St. Luke's at 381-2222, and you can be directed to the Children's Mental Health Clinic and talk to myself or any of our therapists. We have psychiatrists on staff and nurses that are available. So yeah, we're here for the community.
And hopefully with this, we will get this behind us sooner than later. Dr. Roger Olson from St. Luke's Children's Hospital, thanks so much for joining us.
My pleasure. Thank you.